And what have been the obstacles and frustrations that you faced along the way when attempting to develop a better solution? And what have you learned since,
Sure.
deciding to head down this
Sure.
path?
Well, I think my experience probably wasn't much different than Breezometer's founder, right? You're looking for air quality and pollen information, and my impression had been that it was fairly granular. It was very localized, hyper local, and that it was real time, that it was very timely. And unfortunately, when I looked at that, I looked at air quality measurement and pollen measurement, and learned that it wasn't very granular. That for me in Fairfax, Virginia, the closest air quality station or measurement station is over 30 miles away, right? And so it wasn't very granular. And so that's somewhat problematic. And then with pollen measurement, you have a very antiquated way of measuring pollen, right? It's a piece of fly paper that captures pollen spores on it, and someone literally brings down that paper, looks under a microscope, and determines the pollen count and what the pollen type is. So I really felt that was the biggest gap. And so for me, when Breezometer emerged as kind of the global air quality leader, they were taking inputs from satellite data and vegetation data and really getting down to a hyperlocal, 5-meter level. So you could actually deliver personalized symptoms forecasts because you're tracking specifically what they're experiencing, what symptoms they're experiencing with that particular granular data available.
Yeah, and I guess having information from just station data is very useful for doing aggregated type of research. But if you're an asthmatic, knowing that pollution is high, 3 miles down the road is important, but it may or may not be relevant to you. So that hyperlocality is absolutely critical to really understand how it's going to impact you personally and your condition, right?